Great privilege for us to have this one-day training on free diagnostic services for lab technician Nagaland, which was a felt need for a long time, and we were really glad that the RRC Northeast could sponsor this training, and we are grateful for that. Thank you. Thank you, sir.
Although that access to healthcare is the fundamental rights of every citizen of the country. So whatever facilities are available in the health units, that is the PHCs, the laboratory facilities, it should reach to the beneficiaries every corner of the state. So I request all the lab technicians to see that the facilities, whatever is available in the health centers, should reach the beneficiaries, all the citizens of the country. On behalf of the Department of Health and Family Welfare, Nagaland, and all the officers, and on my own behalf, I warmly welcome our Director, Regional Resource Center, Kohima, Dr. Prabha Moktan. Thank you, Madam, for taking all the troubles and coming to Nagaland.
We now have speech by Madam Dr. Prabha Moktan, Director RRC. I now give the time.
Thank you so much for this very warm welcome. I always like to come to Nagaland because of the warmth that we receive, the welcome that we receive here. And this is a very, very important one-day training program. And I'm really glad that NHM Nagaland could coordinate with RRCID and have this training program. Because as we know, Nagaland is one of the few states with very good infant mortality rate. It is only just 4 out of 1,000 live births. And infant mortality actually indicates the health, it is a health indicator, important health indicator. It indicates the development index of a country, of a state, of a nation. So Nagaland is just 4 out of 1,000, whereas all over India it is 28 per 1,000 live births. So I think that's a very good indicator. However, there are some other indicators which we need to also improve in Nagaland, like improve institutional deliveries. The population is around 19 lakhs plus with 12 districts and around, I think, 500 plus healthcare facilities all over the state. So, and we have around 1638 villages here. And one another commendable thing about Nagaland is the communization. It is, I think, one of the earliest in the country and also one of the best. I have visited some of the facilities in the remote areas of Junikoto district and Akuhaito PHC, Ataizo PHC and Akuhaito subcenter, which I think can also go for certification. It is quite good. Earlier also I had mentioned. So, but the lab facility and the training of the lab technician is one very important thing, because as we know, a paradigm shift is happening across the country, in Nagaland too, regarding the health, the infection or the health, whatever it is, like, previously it was more of communicable diseases. Maternal mortality was the thing in which mortality was highest. But now there is more of NCDs. And even in Nagaland, what we see is, I think around 59% is the mortality is more because of NCDs, like cancer, like respiratory cardiovascular diseases, cirrhosis, liver diseases, like that. So, and only around 28% is due to maternal and child diseases, and 10% due to accidental reasons. So, because of the paradigm shift that is happening in the whole health infrastructure of the state, we need to also, improve the diagnostic services in the PHC as well as in the districts and in the community health centers. So as of now, from the portal, what we find is the sub-centers in Nagaland, I think they are doing around 10 tests, and the 10 tests, I think so, and also the PHCs are doing around 40. So we have to increase that up to 63, and the sub-center up to 14. So that is why this training is very, very important. And I really thank the department also to take up this, because we are having an expansion of services, as we all know. Previously, it was a selective primary health care. Just RCH, family planning was there. But now we are having more of NCD, ENT, oral, trauma, emergency care. Everything is being expanded, mental health care. So we need to also expand our this lab facilities. So I thank you, sir, and the whole team of Nagaland for a very warm welcome. And I also thank NHM for organizing this along with RSCNE. RSCNE is there to support and help for everything. And even for 15th FC, I think, the diagnostics and all can be increased with the help of 15th FC. So all the best to each and every one of you. And I hope this will be an interactive program. Please ask as much questions as possible by the lab technicians, so that once you go back to your facility, you can, really improve the diagnostic facility, because that is one major part of diagnosing at the sub-center, so that patients are not sent to a higher center, from the rural areas, because I think Nagaland has 70% of the people are living in the rural areas. So they need not come right up to the state or to the districts to have the tests done. So most of the tests can be done at the primary level. Thank you so much. Thank you so much.
For your words of encouragement and for your assurance that RRC notice is always there for the state of Nagaland. And we look forward to work under your leadership, ma'am. Thank you so much. We now have an overview of the Biomedical Equipment Maintenance Program and Free Diagnostic Service Initiative, which will be presented by Madam Dr. Marinella Sanlam, State Program Officer, NHM.
The dashboard which they have developed, and this is the tagging, the sticker which they have attached, and there's a toll-free number. So their turnover time is within the 24 hours, otherwise we give them a penalty. That's there in the MOU also. So I hope all the lab technicians, you are familiar with this sticker. Next slide. So this is the work done in our state. So far the equipment map is 4,816. Then the number of health facilities is 169. So these are the figures. Next slide please. So this is the number of hospitals that are being mapped in each district. So Kohima is 21 and Pek, these are the highest numbers so far. The total is 169. Next slide please. Then this is the breakdown maintenance. So the maximum number is from Dimapur.
Your guidance and resources has significantly contributed to the success of various initiatives under NHM Nagaland, thereby impacting the lives of many across the state. Your support has been invaluable in our efforts to enhance healthcare delivery system in Nagaland, particularly in ensuring maximum possible tests at different levels of facilities at a cost-efficient way. We deeply appreciate your commitment in supporting us in ensuring essential diagnostic services free of cost to reach to every corner of the state with our shared goal of improving health outcome and accessibility to minimize referral of patients and to curtail patients' out-of-pocket expenditure on laboratory tests.
Actually, my UPC is
Excuse me, hindi naman bisyo dyan. Ay, this one.